Good day. I am LM Canabi Campo from Foundation University Dumaguete, a Level 2 nursing student. And today, I am going to administer parenteral medication, which is the intramuscular injection. Now that we know about it, let's actually do it. Wash your hands, provide privacy, verify patient with name and the date of birth, do our 3 checks, and our 6 rights. Our 6 rights are right patient, right medication, right dose, right time, right route, and right documentation. Withdrawing a medication up from a vial, don't forget to record the lot number and the manufacturing. And also, you want to make sure to check the expiration date. So this is a vial. It's not really real, it's just for pretend for demonstration purposes. It is actually a triple distilled water. Let's just pretend it's a vaccine. Okay, we're gonna give it a flu shot. Something like that. We would pop up the top if it had a top on it. Wipe it with alcohol wipe. And we will get our syringe and needle ready. So this is a 3 ml syringe with 23 gauge needle. So before we draw up from the vial, we need to instill air into the vial. So let's say that our medication record says we're giving 0.5 ml. So we're going to draw back 0.5 ml. Okay, so here, 0.5. Now we're ready to inject the air into the vial. We're going to invert it to turn it upside down. And then we're going to pull back that the same amount. So we injected 0.5 of air, we need to pull back 0.5 of the medication. Okay. One other thing I need to mention is we should always label our injections. Because if this was, to fall on the floor, or you saw it on somebody's, computer on wheels, and you weren't inside the room, and it's just some random unknown clear liquid, right? We don't know what it is. So either take a piece of tape, write the name of the medication on it, or there's actual little stickers that are medication labels that you can put on the syringe. So that's just a safety thing you should always think of. So we're about to administer intramuscular injection to the patient. To do an intramuscular injection in adults, you're going to usually use the deltoid. And to find the right location, you're going to locate the acromion process, which is like the bony part right here. Right here. So this is where the bony part, and then you're going to go 2 fingers down, so about right here is where we want to give it. So let's alcohol it off. So let's alcohol it off and let it dry. And when we use the Z-track method, we're going to use our one hand to move the skin while our other hand hold the needle. So this is our IM injection that's been labeled. So right here, as you can see, it is labeled. And in my procedure, I will not be using any needle. There are no needle right here. So use your hand to move it off to the side, and then at a 90-degree angle, you can inject. So it's like you're shooting a dart, and then hold it with your thumb and forefinger, and then depress the plunger for about 5 seconds slowly. And wait it for more 10 seconds so that the solution will go down to the muscle area. Get it quickly. And then cover it with the gauze. But never massage the area because it will increase the solution going to the subcu tissue. And then dispose the syringe and the needle in the sharp container. So we are all done. After that, do the aftercare and hand washing. And also, don't forget to document the procedure. So that's how you administer parenteral medication, which is the intramuscular injection. So that's all for today. Thank you. Keep safe everyone and God bless.